Her and Dad actually met at the Fisher Theater. She was a candy girl, and he was an usher. When my mom came into the nursing home, my dad came every day to visit her up until a couple weeks before he passed. And she knew when he passed away, and they hadn't even told her yet. She said out loud, "I'm never going to see you again." So it was a pretty close bond. She was always full of life, and she was the glue that held the family together, and just a happy person.
When I first started here at the nursing home, the residents here were almost like a foster care. They were quite alert and oriented. Now, probably 99% of them have dementia, so it is a challenge every day.
I started seeing some signs of my mom's memory slipping probably, I'm going to guess and say maybe about 2004, 2009, 2010, it really started to progress. And I think that was about the time that the doctor diagnosed her with Alzheimer's. And she was still pretty alert when she got the news, and she was very, very upset by it. I remember her being angry and crying and not happy with the news because her mom and her brother had it as well.
She came to us severely cognitively impaired with hyperactive tendencies. She had compulsive ambulation. She wanted to get up all the time and walk.
She was very, very agitated. Yeah, very agitated. She would become angry with my dad, and she didn't lash out or anything physically, but agitated. And she was always up and moving around, and just like she was searching for something all the time.
We had to send her out to a geriatric psychiatric unit because she became extremely combative. She was a harm to herself and others, and we needed to try to figure out a way to work with her without having to give her too much medication. So they sent her out, and she came back to us on with those Haldol, Depakote, Ativan, Boost Bar, and an antidepressant. I think it was Celexa. There was a lot of medications.
We found out that most of the people, probably about 80 to 95% of our people coming in the door were already on a psychotropic medication, and when we talked to families, they didn't seem to know, why they were put on it most of the time in the hospital.
When she came in and was on different medications, she seemed real kind of zombie-like, and I'd find her kind of just asleep or with her head down, and can't get her to focus, can't get her attention.
We did an in-service with all the nursing staff and let them know what we're going to be doing, and that we're going to be decreasing, the medication, so we have to monitor for certain behaviors. And we, our social worker had put in different type of interventions for us to try while we're decreasing the medications.
TLC, a lot of hugs, back rubs, we do hand massages, just try to, we do stories, things to get their minds off of whatever's bothering them.
Sometimes the activities overstimulate them, so we had to find out what was overstimulating them and try to find alternatives, whether it was just listening to music. We started a small behavior group, which is for individuals with dementia that did have behaviors where they were having difficulty with the overstimulation.
We tried to provide continuity of care in addition to having the same CNAs and staff available, and we really tried to maintain that schedule. She had breakfast at a certain time, she took a nap at a certain time, and that really helped maintain, her level-headedness with the whole situation.
They're wonderful. They're wonderful. They love her, and I can tell, and they take very good care of her. And I have no worries at all. And she loves them.
You read when people come in that they're, all these bad behaviors coming in, and you're monitoring them, and you don't see them, and they're on the medications. But as you start taking people back, actually, we saw people improve, which is amazing.
I think the most rewarding part is to see the quality of life that the residents have now, and that we see more interaction with them, their family members, and the staff.
Oh, I see a big difference, a big improvement. she's more alert, and she can focus sometimes on me. And I even think that sometimes she recognizes me, whereas before there was just nothing. It was pretty much just nothing.